Welcome back to the Neurometabolic video series. My name is Dr. Sean Price, Clinical Director here at Chiro Spa in Fort Walton Beach, Florida. Today's topic, we're going to talk about lab values. A lot of patients come into the office and they're experiencing symptoms of hypothyroidism or low functioning thyroid, such as brain fog, fatigue, inability to lose weight, a lot of difficulties in their life just functioning and getting through the day with just such a low amount of energy. And they go to their doctors and they get their lab values run, and the doctor says there's nothing wrong, you're totally normal. And so they come into the office and they bring their lab values in there, and like they don't understand what's going on. So that's why I wanted to shoot a video on lab values and explain to you why you can still be having these symptoms even though your lab values are technically normal. You see, lab values, they're typically a broad-based value, and we're going to talk about thyroid stimulating hormone today as the example of what I'm talking about. If you're not sure about what TSH is, please go back to my website. It's www.drseanprice.com. That's drseanprice.com. Click on the tab that says Dr. Price's videos, and you can see all of the videos that we've shot up to this point are on that tab, and you can watch those and you'll understand what's going on and what thyroid stimulating hormone is, and some more really good information about what could be going on with you. So thyroid stimulating hormone, or TSH, is the test that is typically run by most doctors to see how your thyroid is functioning. Now, they may run some other tests as well if you're lucky, but for the most part they're going to run that TSH to determine what your functional level of the thyroid is. As long as your test falls within the range of 0.35 to 5.0, then you're considered normal. So then, well, why am I having symptoms if I fall within this range? Well, according to the labs, if you're normal, then it must be in your head, or there must be something else going on that the labs aren't showing. The simple fact of the matter is that these lab values are too broad. They allow for what is quote-unquote normal, or what is not quite a disease process yet. What we look for in functional medicine, we look at optimal ranges. We look at where it should be for you to be functioning optimally. So the lab values we're looking for is 1.8 to 3.0 on the TSH. So if you come in, or if you go to your medical doctor and your TSH level is at 4.2 and you're having symptoms of hypothyroidism, you can't lose weight, you're fatigued, brain fog, no energy, if you're having these symptoms, well, that 4.2 falls within normal, so there's nothing wrong with your thyroid. Whereas if we look at that same lab value, we're going to say, okay, you're out of the optimal range, we need to try to address this. Now, this is why you can have normal lab values and still have symptoms and still not feel well. And this is the same for all lab values. This could be it could be your T3, your T4, all the different lab values that we look at for different indications of different situations in different parts of the body. So keep that in mind when you're looking at your labs, and next time you go into the doctor and they bring you your lab values and everything's normal, well, keep in mind that they may be normal in a disease process concept, but not normal functionally or optimally. Feel free to bring your labs to us when you set up your consultation here in the office. One of the things that we'll do is we'll go over all these lab values and see if you're in the functional ranges or not. So it's very, very important that this concept goes into the definition of health. Health is defined not merely as the absence of a disease or an infirmity, but as optimal function mentally, physically, and socially. And you cannot regain your health by practicing sound principles one day, 1 week, or 1 month at a time. You most certainly cannot regain your health one diet, one exercise, or one miracle pill at a time. However, you can regain your health and reinvent your life by following a customized program that teaches you the right choices to make for your body and making those right choices one decision at a time. My name is Dr. Price. Have a great day.